Yogesh here, and I am your community medicine faculty at BCNAV. So, topic of our seminar today is epidemiological studies, and it is very bad that in community medicine started in the first year, and the epidemiological studies जो है वो first year में ही पढ़ा दी जाती है ना. So that's why when we reach to pre-final epidemiological studies जो है वो हमारा weak रह जाता है, and in every exam many times the question has been asked from the epidemiological studies, and it is not only important for the UG and the NEET PG. After getting selected in MD or MS courses, you will find that epidemiological studies will be useful for there, because when you will do some research papers and you will do thesis, so it will be used there. Okay, so I think we should start the topic here. So, what is epidemiological studies? Okay, keep this thing in mind from starting of the disease. We take that when there was few diseases in the early era, or when human encountered with the disease, what will happen initially? The human tried to find out. He tried to find out that what is the cause of disease, what are the risk factor of the disease. Okay, so for this epidemiological studies has came in existence. And in this session, we will deal with theory. And after every topic, I will ask some MCQs for your practice also. Okay. So let's begin with the learning objectives of this session. So in learning objectives, you will be able to understand the key concept of the epidemiological studies, and you will be able to understand various type of epidemiological study designs. Okay, and you will be able to solve the MCQs related to this topic. So now, initially, why epidemiological studies needed? So before coming to epidemiological studies, let me tell you one more important thing, that what is epidemiology. So initially, we were thinking that study of epidemic is epidemiology, which is wrong. Okay, so don't take this bet that a study of epidemic is epidemiology. Many time in Viva, student usually replied that study of epidemic is epidemiology. No, it is wrong. It was previously it was used to think by the epidemiologist, but not only the study of epidemic. Epidemiology is the study of all type of the diseases, not only the epidemic. So here epidemiological study why needed? So we should know, or we want to know everything about the disease. We want to know what is the disease, what is the disease subject, what is the duration of the disease. So we want to know about the 7W. 7W, you know, why, what, when, where, how, everything about the disease. And we should try to find out the etiology. We should try to find out the risk factor and incidence of the disease, prevalence of the disease, incubation period of the disease, clinical features of the disease, and what is the natural history of the disease, what are the treatment, what is the preventive modalities, what is the treatment modalities, all these things. Okay. So when we study different type of the epidemiological study, we will come to know that these studies are not mutually inclusive or mutually exclusive. ऐसा भी नहीं है कि ये सारी स्टडीज सब एक साथ एक जैसी हैं, और ऐसा भी नहीं है कि एक दूसरे से बिल्कुल अलग है. सो दीज आर कॉम्प्लीमेंट्री टू ईच अदर. इट इज जस्ट अ प्रोसेस ऑफ इवोल्यूशन. इनिशियली जब ह्यूमन ने, ऐसा हुआ कि कोई डिजीज के बारे में पता लगा, व्हेन इनिशियली जब व्हेन अ पर्सन know about a disease, so he might know few things about the disease. Later on, the as the epidemiological studies advanced, the knowledge about the disease increases day by day according to the epidemiological studies. Okay, so initially, from beginning, the about the classification of the epidemiological studies. So there are two type of the epidemiological studies. Number one is observation, and number two is experimental. So what is happening if you see some people are fighting on the road, है ना, सड़क पे कोई झगड़ा हो रहा है, what will you do? You will either observe like other people, or some people might intervene in between the fight. So similar we are doing in the epidemiological studies. If there is a disease and we want to study, so what we can do, either we just observe the disease, we just observe the disease in the patient, or in the person, or in our population in which we are doing a study. So what we do, we will just observe. Okay, or we can do some experiments. What experiments we can do? we can try the treatment, we can try some diagnostic procedure. So when we will do some experiment, it will be considered under experimental studies. Or when we do nothing, we just observe the clinical feature, we just observe the outcome of the disease, we will just observe the risk factor, it will become under observational studies. So observational studies, in observational, what is happening? It is just a natural history of the disease. We are not doing anything. And when we are not doing anything, disease is progressing according to the nature automatically. Whatever is happening in the nature, disease course will go automatically according to nature. So in observational study, we just observe the natural history of the disease. Okay. Means after how many days the clinical features started in the patient, after how many days patient outcome become poor or become greater. So all these things, okay. And we observe the natural experiments also. Now, what is about the natural experiment? Natural experiment means what the which is happening automatically. We are not doing anything by our will. Okay, in a study, suppose a patient is of diabetes and we are observing a patient of diabetes for further development of the diabetic neuropathy. And in between, he started doing some exercises, he started doing some lifestyle changes. So it is a natural experiment. Okay, we are not doing, we will not say the patient that you start lifestyle modification. We will not say patient that you should quit the alcohol, you should start the alcohol. We will do nothing. Okay, we just observe because we will make the result according to the observation. If we find out that this person was not doing any exercise and the outcome was poor, we will write it as it is. That the outcome was poor because patient was not doing any exercise. Okay. So this is the observational study. We will do no intervention. Keep it in mind. So here is a question that in observational study, we will do nothing. Okay. And in experimental, we will do some experiments. We will do some intervention. So we will discuss it more in the next slides. Now, in observational study, we are again classified the study into two type, descriptive type and the analytical type. So in descriptive studies, what we will do? In descriptive studies, these studies are time, place, person study. Means we will describe the disease according to the time, according to place, and according to person. Time is relation of the disease with the time, means relation with the incubation period, relation with the seasonal trend, relation with the in secular trend, or place. Place means geography, geographical distribution of the disease, rural urban distribution of the disease, and person. So distribution of disease according to person, according to gender, according to racial factors, according to genetics. So it may be it is a part of descriptive. Okay. So why by using descriptive study, what we do, we just formulate a hypothesis. Suppose in the world, first time, few cases of diarrhea came in existence, and we started descriptive study. So how we will formulate the hypothesis that these person have consumed old food, undercooked food, and after eating undercooked food, they developed diarrhea, food poisoning. Okay, so this will be our formulation of hypothesis. Now in analytical, we will analyze the hypothesis, whatever we made in the descriptive epidemiology. So we will analyze, it means we will test the hypothesis. Analysis is a part of testing. Okay, analysis, what is analysis? Analysis means data analysis. So in analysis, we will apply some test and we will, after analysis, we will test the hypothesis that whatever hypothesis we made in the descriptive study is analyzed by the analytical studies or test by the analytical studies. What we will do, we will try to find out a relation between the health status and the variables. Or we can say we will try to find out a relation between the risk factor and the disease, or risk factor and the outcome, or the causative factor with the outcome, causative factor with the disease. So these things we will try to find out. in the analytical studies. Okay, it's simple. Now, type of the various analytical studies. So there are four type of the analytical study. Number one, the cross-sectional study. In cross-sectional study, the study population is individual. Then case control. We will come later about the ecological. CCC. There are three C. CCC. Cross-sectional, case control, and the cohort. So in all these three, C, individual is the study population, and for ecological study, population is our study population, full population. So ecological studies are simple. In ecological study, we generally talk about the general statement. What are the general statement? We generally say that Indian population is prone to diabetes because of the obesity, or Indian population is obese. So it is a general statement. So what will happen in the general statement? A person who is not obese will say that why you are blaming me? I am not obese. But in ecological study, we usually pass the general statement. So here individual person will say that I am not obese. So it is called individual fallacy. So individual fallacy is a disadvantage of the ecological studies. Okay. So we will discuss about the case control cohort in the course section in the later slides of this lecture. Okay, this webinar. Now about the experimental studies. So what we will do in experimental studies, we will confirm the hypothesis, and experimental studies are always prospective. So how it is happening? Uh, suppose there are few cases of the COVID, or okay, we will take the example of COVID because it is very new to us. So there are few cases of the COVID initially, and in descriptive studies, what we find out that this is a new disease, which is a disease of respiratory origin, and the mode of transmission is from respiratory or droplet infection. Okay, and the person who is comorbid is usually or have greater chance or high chance to be infected. This is the our descriptive study. Okay. So according to time, place, person, we have decided this. Now, in analytic study, what we will do? So there are four type of the analytical study. So in generally, in when the patient comes directly to us, we usually use case control. Okay, we will discuss it later. So here we apply case control study and we try to find out that COVID is obviously a disease of respiratory tract infection. Now, and the virus which is associated with the COVID is coronavirus. But how we confirm this? We will confirm this by experiment, and we will introduce that same coronavirus in a human volunteer. And later on, if the person developed same symptoms, it means the disease causation is confirmed by the experimental study. So in experimental study, it is a prospective study, and in experimental study, we always go prospective. It means what we will do, we will introduce the causative agent inside the body, and we will wait for the development of the clinical features. So we will see by our own eyes that after introducing that particular virus in the human body, that human developed these clinical features. It means this causative agent is confirmed with the causation of this disease. So this is how we confirm the uh, our diagnosis. So this is by the experimental studies. Now what is happening? Here you will think that it is very inhuman. Okay, it is very inhuman that we are introducing a virus in the human body. But this is how medicine works. This is how medicine works. We have to be inhuman, and these are the human volunteers. They have already consent has been taken from these persons. Okay, so you understood, I think. Now about the different type of the experimental studies. So there are three type of the experimental studies. In general, RCT is the synonyms with the experimental studies. When someone do RCT, randomized control trial. So we just to say the what is the experimental study? Study is simple RCT, randomized control trial, also known as clinical trials. Then there are some field trials also, and there are some community trials also, a part of experimental studies. We will discuss when we take another webinar on the experimental studies. But today we will not go much about the experimental study. You just keep this in mind. In experimental studies, they are always prospective, and we will do some intervention or we will do some treatment. Okay, some treatment or some diagnostic modality, but we will do actively something in the experimental, and we have to take the consent from patient also, huh? And we have to take some ethical clearance from the where we are doing this activity. So we have to take permission from the ethical committee also. Okay. Now some MCQs. Which of the following study is not a analytical study? It is simple. So which of the following study is not a analytical study? Obviously, so we have discussed that community ecological study. Okay, cross-sectional was now retrospective. So I didn't tell you about the retrospective study. It is the case control study. And cross-sectional can be retrospective. Okay, we will discuss about this. So B is correct answer, community trial. Okay, the next question is, which of the following studies is not a experimental study? So ecological study is not experimental because we have studied it in the analytical part, that ecological cross-sectional case control and the cohort and clinical trial, field trial, and community trial. Always when there is a named trial, it means it is experiment. So A is the correct answer. Now, third question, descriptive studies perform all the functions except. Descriptive studies perform all the functions except. Okay. So I told you three things. We have descriptive, we have analytical, both are the part of observational, and we have experimental. From descriptive, what we are doing, we are starting a hypothesis, means we are forming, formulating, or we are generating hypothesis. So in descriptive, we are generating. Now we will analyzing, we will testing the hypothesis in the analytical part, and we are confirming the hypothesis in that experimental one. Okay, so here when okay, देखो such type of question how to solve. They have given one option: test the hypothesis, describe disease, describe the place, and generate the hypothesis. So the answer will be from option A and from option D. It is confirmed. B and C cannot be answered because they have given a different option. Now test the hypothesis. So already told you, then in analytical study we are doing this. So answer will be test the hypothesis. Though other all students replied the test the hypothesis question. Answer is test the hypothesis. Okay, it is correct. Now, for which of the following is not a unique feature of experimental study? Which of the following is not a unique feature of experimental study? Okay. Which of the following is not a unique feature? Unique feature नहीं है. The experimental study is always prospective. Always prospective. This is a unique feature. There is a random allocation of subject to the study. So I told you experimental study is generally called RCT, and in RCT what we do, we will do random allocation. Okay, and the investigator introduced the intervention. The investigator introduced the intervention. Have you heard about this? Okay, oh, no problem. I will discuss in later. This is the correct here. So many students have replied on option B. Okay, option B is the right answer about how and why. That which of the following is not a unique feature. Prospective is the unique feature, but it cannot be retrospective. How will you do a experiment retrospectively? Is it possible? If a person is coming with a disease, okay, and we will going backward, how is it possible? We cannot do experiment in the backward, है ना? In retrospective direction में possible ही नहीं है. So यहाँ पर the study can be both prospective and retrospective. ये हमारा आंसर नहीं हो सकता यहाँ पर. Okay, understood? So answer will be B. And the about the who typed C, there is a random allocation of the subjects to the study control group. So here we are doing randomization. So why RCT? What is the full form of RCT? In RCT, randomized control trial. So when we talk about the experimental study, we usually talk about the RCT. So randomization is a part of the RCT. It is a part of experimental study. Okay. Now we will begin towards the descriptive epidemiology. I think uh, good to go to the descriptive epidemiology. This is I we have already discussed about the epidemiological studies. Now we are going toward the descriptive epidemiology. So descriptive epidemiology is a part of observational study we already discussed, and it is the first phase of the epidemiological study. It is the first type of the epidemiological study, or we can say it is the first phase of the epidemiological investigation, and it is done on the population rather than individual. For individual, we can do case control study, we can do cohort study, and we can do cross sectional, which is a part of analytical. But when we talk about the descriptive epidemiology, because we have to know much more about the disease, so we will usually do descriptive epidemiology on the population. And the one example is investigation of an epidemic. So when you study investigation of the epidemic, or you might have been heard of, you might have been studied about the investigation of an epidemic, we are doing the same thing that we are doing in the descriptive epidemiology. Okay. And what is the main aim? So descriptive epidemiology is also called time, place, person study, TPP. Okay, TPP. So time, place, person study. So we will try to find out about the uh, relation of the disease with the time, with the place, and with the person. So when is disease occurring? Where is it is occurring? And who is getting the disease? So we have to know about these three things. Okay. Now, what is the process? What is the steps of the descriptive study? We will go through it quickly, define the population in the study. So we will try to find out that on which population we have to do this study. Suppose we are doing this study in a village, okay, or in a colony, or in a community. So we have to define the population under study. Now, define the disease under study. So for define the disease under study, what we will do, which disease we have to on which disease we are trying to do this study. So in investigation of epidemic, we are doing the same thing. We are also defining the disease also there. Now we will describe the disease by time, place, person. We will measure the measurement of the disease. Okay, we are comparing the known indices. What is comparing the known indices means, suppose we are trying to find out that last year there are a few cases. Now we are having more cases. Oh, this can be an indices. Suppose we have some patient with the comorbidity like hypertension, and there are some people we are not having hypertension, and the relation of the disease with the hypertension and non-hypertensive. So these are the known or non indices. We will discuss it in detail. Okay. Then formulation of the hypothesis. So first is the define the population under the study. So how will you do? If we want to define the population under study, the total number of the population and the variables. How variables? That the relation of the age with the disease, relation of the gender with the disease, relation of the occupation with the disease, relation of culture, and anything like socio-economic status, like income. Okay. So we have to define the population. Now, either whole population or sample or specific group. So if the village is small, we can include all the residents of that village in the study. If the population is large, we can take samples, or we can choose a specific group to study. कि हमको सिर्फ सपोज हमको सिर्फ कॉलेज स्टूडेंट्स पर स्टडी करनी है, वी हैव टू स्टडी दिस डिजीज इन द कॉलेज ग्रुप ओनली. सो वी उससे क्या होगा, आवर पॉपुलेशन साइज विल, आवर स्टडी सैंपल विल डिक्रीज. ओके. देन स्पेसिफिक ग्रुप लाइक स्पेसिफिक ग्रुप ऑफ एज, कि भाई हमको 10 years से बिलो में स्टडी करनी है, और वी हैव टू स्टडी इन द पर्सन मोर देन 65 year ऑफ एज, और मेल में करना है या फीमेल में करना है, और पर्टिकुलर ऑक्यूपेशन वाले लोगों में स्टडी हमको करनी है, तो इट कैन बी आल्सो देयर. देन पॉपुलेशन शुड बी लार्ज इनफ. तो ऐसा नहीं है कि हमने 50 पेशेंट पे स्टडी करके आ गए और हमको उन 50 पर्सन में कोई बीमारी ही नहीं मिली है. ओके, तो ये भी नहीं कर सकता. आवर सैंपल साइज शुड बी लार्ज इनफ, आवर पॉपुलेशन should be large enough so that we can conclude something. Okay. Then a stable one. So our study population should be stable one. No migration. Okay. ऐसा नहीं होना चाहिए. Our study population should not migrate. Otherwise, in meanwhile the study we are doing, the population will migrate, and we will find out, we will in search of the our population where is going. Similarly, when in medicine or surgery examination, we take a case, and when the examiner coming for केस वाइवा एंड वी से सर मेरा केस तो भाग गया, तो वैसा ना हो जाए, है ना? तो इन अ स्टेबल वन हु इज रेजिडेंट हु इज नॉट, वी हैव टू नो. So migration is also important point. We will discuss about this. And a health facility made available for the community. So when we are doing a descriptive study, a health facility should be available. Why? Because it will needed for the investigation purpose. Then why defined population is important? Because defined population is work as a denominator. How? Suppose we are studying a disease on 1,000 people, and in that 1,000 people, we are finding 100 cases. So it means our incidence will be 100 upon 1,000. That is 10%. So to get the data in a measurement form, we will need the denominators. Okay. Now define the disease under study. So we have to take the operational definition of the disease, where we can we should define the disease, and definition should be accurate, precise, and the valid. And we should clearly instruct that who is case. हाँ, किसको हमें केस मानना है और किसको हमें केस नहीं मानना. सपोज एक पर्सन इज कमिंग टू ए क्लिनिशियन एंड saying that I am having headache. So he will treat him for headache. He will give him some NSAIDs, some painkiller. But epidemiologist must know that headache is a migraine or tension headache or cluster headache, because we are doing study on a particular headache. Okay, either we are doing study on the migraine, or we are doing study on the tension headache, or we are doing study on the cluster headache. So our operative definition should be clear cut, that on which type of the case we are doing our study. Diagnostic test must be acceptable and applicable to the population. Okay, if you are going in a village and you are suppose you are studying benign prostatic hyperplasia, and you will say that we will do digital rectal examination of each patient, then what will happen? No one will come to you. Okay, क्योंकि बेचारा वो आपके पास आकर के डीआरई करा के भी गया, तो गांव में लोग उसके लाएंगे नहीं फिर बाद में कि देखो ये क्या करवा के आ गया है. तो इसलिए डायग्नोस्टिक मेथड मस्ट बी एक्सेप्टेबल एंड एप्लीकेबल एंड देयर शुड बी इजी टू डन, easier to done. Okay, then identified cases should actually have the disease. जिन जिन केसेज को हमने आइडेंटिफाई किया उनको डिजीज होनी भी तो चाहिए. केस डेफिनेशन शुड बी सेम थ्रू आउट द स्टडी. ओके, इट इज सिंपल. केस डेफिनेशन हमें चेंज नहीं करनी, अदरवाइज हमारा केस सिनेरियो चेंज हो जाएगा. देन operational definition should be there, by which disease condition can be identified and by which we can measure the disease. Suppose for tonsillitis, so clinician, what is the definition of tonsillitis? We usually say inflammation of the tonsils. Okay, this is simple definition, usually by streptococcus pyogenes. But for epidemiologist, what we will find out, if we are going in the community, we are not doing any throat swab. In descriptive epidemiology, we are just going and we are seeing inside the mouth. So what we will see? We will see that there are some red tonsils, there are some exudates. Okay, and later on we will do throat swab culture. So there is here is a definition, the presence of enlarged tonsil, red tonsil with the white exudate, and there should be streptococcus pyogenes in the throat swab culture. It is the exact operational definition. We have to make this. Okay, so epidemiologists can also make their own definition according to the need. Now we will describe the disease according to the time, place, and the person. What is it according to time, place? So there are three things in the time distribution. There should be some short-term fluctuation. Either there must be short-term fluctuation, or periodic fluctuation, or long-term fluctuation. So there are three things: short-term fluctuation, periodic fluctuation, and the long-term fluctuation. We will discuss these all three things one by one. So first of all, we will go to the short-term fluctuation. You know, short-term fluctuation means what is the short-term fluctuation? The word fluctuation, there is some changes. Okay, fluctuation in the frequency of the disease. And for short term means there is some recent condition, or there are some there are some changes in the disease for the brief period, for short term. Okay. So in short term, we study epidemics also. And what is epidemic? Few years back, we have witnessed COVID, which was for 1 or 2 years. So that was a short term. Okay. For 3 months, there was one wave. For another 3, 4 months, there was another wave. Another for 1 or 2 months, there were one more wave. So there is wave, and that is for the brief period. So it is called epidemic. So what is epidemic? Epi means upon, demi means demo, demo means population. So there is a disease which was not present there or which was under the normal expectancy. Now what is happening? The disease is more than normal expectancy. We are not expecting the disease in such a frequency. Now cases are more. Suppose there was a disease which was not in India. Suppose yellow fever. Suppose smallpox. Yellow fever is not in India, not even a single case. Smallpox is eradicated from the world. Now polio is eradicated from the India. So if there is a single case of this disease coming to us or happening in India, what will be happen? It will be considered as an epidemic. Okay, because what we will do 1/0. Why one? Single case is one upon zero means the cases in last year. So that is zero. So 1/0 is infinity. Similarly, if we say that the cases of dengue was 1,000 last year, but this year we are having 10,000 cases. So now what we will do? We will do 10,000 upon 1,000. That is equal to 10. It means the cases are more than in normal expectancy, and it should be more than +2 standard deviation. Okay. So if number of cases this year are more than +2 standard deviation of the last year, it will be considered as an epidemic. And if a disease which was not a part of your country, if a disease which was eradicated from your country, and if a single case was coming to us, it will be considered as an epidemic. Okay. So epidemic means number of cases more than normal expectancy. How much? More than +2 standard deviation. It is important thing. Then occurrence of the new disease. Because occurrence of new disease means because previously we were expecting zero cases. So it will obviously standard deviation will be zero. So single case will be higher than the +2 standard deviation, or recurrence of the eradicated or eliminated disease because normal expectancy for these disease was zero. So this is called the epidemic. Now, what is epidemic curve? So we will discuss about the epidemic curve. Epidemic curve is the graphical presentation of the cases of the disease with the time. So we will need this epidemic curve. Okay. So here in short-term fluctuation, we are having three classifications, sub-classification or subtypes. That is, short-term fluctuation are also known as epidemic. It can be common source epidemic because the source is common, propagated epidemic, and the slow epidemic. So in common source, there are single exposure and the continuous exposure. So totally we will study four type of the epidemic here: common source single exposure, common source continuous exposure, propagated, and the slow epidemic. Okay. Now about the common source single exposure epidemic. What is this? Common source single exposure epidemic. So what is happening here? Here, common source, single exposure means there will be exposure of the risk factor of the causative agent will be one time only, single exposure. Suppose there is a bomb blast. Suppose there is a release of any gas. So it happened in India, Bhopal gas tragedy. In Bhopal gas tragedy, the methyl isocyanate released in single exposure. So what will happen in bomb blast? What will happen in a bomb blast? What will happen in the what happened in the BGT? There is sudden surge of the cases and sudden down. Okay. So the epidemic curve will be like this. Here you see the graph, the of exposure. Here is the exposure in the beginning, and there is sudden surge of the cases and sudden down of the cases. Okay. So it is happen in the common source single exposure epidemic, which is also called point source epidemic. The example will be accidents, Example will be food poisoning or Bhopal gas tragedy. Okay. So what is happening here? There will be multiple or many cases, large cases within a brief time, within a short time of the interval. Okay. So because there are sudden cases, na, so there will be a rapid rise of the cases. So there will be cluster of the cases. There will be explosive growth of the disease. Explosive cases, epidemic curve will rise suddenly, will fall suddenly, and there will be no secondary wave because there was a single exposure. So there will be no secondary wave. All cases will have same incubation period. Okay. So this is the common source epidemic. Now, common source continuous exposure or repeated exposure. So what will happen? The repeated source is the common, but exposure is the repeated. So in that case, when source is common, the growth of the curve will rise suddenly, but will not fall sharply because the source is continuous. Suppose we are talking about the water supply in a hostel. If in a hostel the water supply is contaminated and the water tank the installed water tank is having contaminated water supply, there is some students will affected with the jaundice or hepatitis. But if we will not clean that contaminated source of water, what will happening? The cases will increase day by day. So there will and when disease recover, but there will be gradual fall, not the sudden fall. ऐसा नहीं होगा कि एकदम से आज पानी सबने एक ही दिन में सारा पानी पी लिया और एक दिन में सब बीमार हो गए और अगले दिन हमने पानी वाटर टैंक बिल्कुल ठीक कर दिया और अगले दिन सब ठीक हो गए. सडन फॉल नहीं होगा. ओके. सो सडन फॉल नहीं होगा. बाय वाई? बिकॉज द सोर्स इज कंटिन्यूअसली प्रेजेंट देयर. Okay. So common source and repeated exposure, like sex worker. So what is sex worker is doing? Sex worker is a common continuous source, and it will increase the cases, and there will be gradual decline. Okay, gradual fall. Understood? Then one more thing, faulty vaccine is also a part. If we have faulty vaccine supplied in our vaccination center, what will happen? We will having cases of adverse drug reaction or adverse effect following immunization. Okay. So suppose a nurse injected 50 patient in the OPD with some DPT vaccine. Out of them 50, 40 or 45 kids are having some AEFI. Next day, the nurse injected again more 50 students or more 50 kids, so there will be more AEFI. So till the faulty vaccine is available there, there will be in cases will be increases continuously and fall will be slow. Okay, understood. Now, third one is the propagated epidemic. So in propagation means continuously going on. So it means there is an infection in the community. So there will always be infectious origin like vector-borne disease, like animal reservoir disease, like person-to-person transmission, like it we have seen in the COVID, we have seen in the dengue epidemic. Okay, so here the disease will take time to develop from 1% to 2%, 2% to 4%, 4 to 6, 6 to 8, till the communicability is seen, till the infective agents persist in the community. So there will be a gradual increase and there will be gradual fall. So what we see in the point source epidemic, sudden increase in the cases, sudden fall. In continuous common source, what we see, sudden increase but gradual fall. And in infectious or propagated, we will see gradual increase and the gradual fall. So there is a difference in all three type of the epidemic curve. Okay. Now, the spread of the propagated epidemic depend upon the herd immunity also. So we have seen in the COVID that it was time taking during for the development of the herd immunity. For herd immunity, we must have 60% immune population. Okay, our population should be 60% population should be immune towards a disease. After that, we can say that herd immunity has been developed. Okay, depends upon the secondary attack rate of the agent also. If a disease is having high secondary attack rate like diphtheria, like measles, the cases will increase rapidly. If the disease having low secondary attack rate, cases will not increase so rapidly. Okay. Then propagation increase with the susceptible population. If the population is susceptible, obviously the propagation of the disease which will be rapid. Okay. And when the epidemic ends when all susceptible population depleted. How? If a disease is producing active immunity after the cases. So if a person who is who got infected with the disease automatically will have active immunity, and either we can immune the person by vaccination. So it was happened in the vaccine in the COVID era. What we did, the person got infected with the disease already either expired, or if the outcome was better, patient got the immunity, and some carriers also got immunity, and after vaccination we give the immunity to whole in our country. Okay, so what we have to do in such case, for propagation epidemic, we can do something. We can break the chain of transmission. Okay. And how to break the chain of transmission? It depends totally upon the mode of transmission. If we are having a respiratory mode of the transmission, in that case, we will use mask and social distancing. If we are having GIT type, gastroorofacial route of type of the transmission, we will we will maintain the hygiene. We will consume the uh, good food or not infected food. Okay, it depends. If disease is vector borne, now we will try to break the chain of transmission by killing the mosquitoes, by inhibiting the growth of the mosquito. Okay, this is the propagated epidemic. Now, modern epidemic or slow epidemic. So NCDs, non-communicable disease, are called modern epidemic or slow epidemic, because these cases are also increasing, not as much increasing as in the COVID, not as much increasing in the tuberculosis, but these cases are increasing in a decades. Okay, over the decades. After before 30, 40 years, you see before 30, 40 years, there were less cases of the hypertension. Nowadays, hypertension comes in the age of 30. Diabetes come in the age of 30. Previously, it was coming in the age of 60. So cases of the diabetes and hypertension are increasing day by day, but not rapidly, gradually. So it is called a slow epidemic. Okay. And it depends upon the lifestyle and how changes in the lifestyle happen. Okay. Now, what about the periodic fluctuation? So it was the short-term fluctuation, now periodic flux. Periodic means there should be a period. Okay. So when there is a occurrence of disease, it is defined by a period. Suppose seasonal trend. So seasonal trend depend upon the season. Some disease comes in a particular season. Okay. How we can say that in summer we have growth of mosquitoes. So mosquito-borne disease usually uh, affect the population when there is uh, either initial of the summer or after the rainy season, because after the rainy season there is collection of the water, so there is a chance of growth of the mosquitoes, okay, for development of the mosquitoes. So it depends upon totally on the season. Suppose in the winter season there are cases of the khansi zukam, okay, coughing and cold, URI. So cases of URI are high in the winter because it is called seasonal trend. Heat stroke cases increase in the summer. Okay, every year there are some news in the newspapers that लू लगने से इतने लोग मर गए. Okay, heat stroke से इतने लोग मर गए. This is called this is the seasonal trend. Okay. Oh, now one more thing, cyclic trend. So there are some disease which are occurring in every 2 year or 3 year. Suppose in the pre-vaccination era, there are measles cases were rising in every 2 3 year. You might heard about of the swine flu. The first epidemic came in the 2009. After that, one more outbreak in 2012. Then one more outbreak was in 2015. Then one more outbreak was in 2018. So at every 3 years, there was cases of swine flu. It is called the cyclic trend. Okay. One more thing, in weekends, you see the cases of accidents are high because in weekend we are having parties. Okay, from Monday to Friday, Monday to Saturday, we are doing work, and on Saturday evening, everyone is going for outing and drinking and driving and increased chances of accidents. So uh, this is about the cyclic trend. Now, long-term fluctuation. which is also called the secular trend. So what is this? The secular trend means the changes in the incidence over a long period of the time, usually years or decades. So it is almost similar with with the this thing we have studied modern or slow epidemic, but here we are talking in the term of epidemic. Here we are talking in the term of long term fluctuation, but both things are almost similar, because you see the cases of coronary heart disease or diabetes or the lung cancer have been increased in last 50 years, and the cases of communicable disease are decreases in the last 50 years. So this thing is different from the modern epidemic. This line is different from the this modern flow epidemic. Why? Here we are talking about the increase in the cases only. Here we are talking about epidemic only. Here we are talking about both the things, increase and the decrease. Here we are talking that the cases of the NCD increases in last 50 year, and cases of the communicable disease are decreases in the last 50 year. Okay. So like polio is eradicated, the cases of typhoid are in control, cases of leprosy is in control, TB is in control. So this is, we can say, long-term trend or secular trend. Now, this was total about the time distribution. Now we will talk about the geographical distribution or the place distribution. So disease also depend upon the geographical distribution, and we can use this distribution to compare with the uh, disease in between two countries or two cities or rural urban changes. We can say difference, rural urban difference of the disease we can compare. Okay. Now, suppose we think like international variation, you see oral cavity cases are high in India. Due to tobacco use, we will see the cases of oral cavity cancer are higher in India, while due to tobacco, the lung cancer is high in other countries. Why? Because in India, tobacco is consumed in the form of chewable tobacco like henny, like gutka. It is more in India, so that's why the oral cavity cancer in male is higher in India rather than the same content, the same nicotine is causing lung cancer in Western world. Why? Some you understood? Now we can say in national variation, like goiter in the sub-Himalayan area. You all know goiter is high prevalence of goiter in the sub-Himalayan range. This is national variation. Now we can say rural urban variation. So zoonotic diseases are high in the rural area because there is a high chance of the interaction between the animal and the human in the rural area, in the tribal area. IMR and MMR high in the rural area because of the non-availability of the medical services, and non-communicable diseases higher in the urban area because non-communicable disease high urban because of the slow sedentary lifestyle. Then we can say local distribution of the disease, also a geographical distribution. We can make a area spot map to identify the cases in a colony or in a community. We can find out the cluster of cases in by using area export map. Suppose we are having address of the all patients of a colony of a city. Now we will pinpoint these addresses in a map. We can find out that this is the if there is a cluster of cases from a particular colony, it means the problem lies in that colony. Suppose we are having cases of the diarrhea from a particular colony, and the all people of that colony are drinking water from a well, it means the well is contaminated. So it was done by the Johnson. Okay. Then about the migration study, it is very important that what is the migration study. So if we want to recognize the cause of the disease lies in the genetics or in the environment. Suppose 100 patients from Africa coming to India. That 100 patients are having a disease. Suppose they are having a disease Ebola. Okay, Ebola. इसे मान लिया Ebola. Now, after coming to India, what we see, these population इनको कभी दोबारा केस हुआ ही नहीं ऐसा आने के बाद. Suppose 100 patients are coming from Africa, from a region where Ebola is prevalent. Okay. Now these population migrated to India, and after coming to India, they have never having that disease. It means The disease was in the genetics or it was in the environment. It means the disease was in the environment. Okay. If a population, a migratory population are coming from Africa to India, and after coming to India, they are having they are affected by a particular disease. It only that population. It means that disease was in their genes. So if a disease was in the environment, they will not have the same incidence after migration. But if disease in the genetics, they will bring the disease to the another country. So it depends upon the in the population of the country of the origin of the migration, among the migration population, and in the population of the host country. So it depends upon three things. Okay, the incidence of the disease uh, in the country or where the people are coming, in the host country, and the population of migration. Okay, depends upon these three things. So this is the same thing I already told you. Suppose we are having an example, migration of sample population between a geographical different population A and population B. And what we observe that comparison of disease and mortality data in sample migration population, sample migrants, if disease and death same to the local. So if disease and death become same to the local, it means there is a environmental effect. Because if a person who is a migratory person is having same disease when with the host country, it means that effect of the environment. Suppose uh, a person who is living in the North India, in Kashmir, suppose in Kashmir, and he came to Rajasthan. And after coming to Rajasthan, working in the mines, he are developing pneumoconiosis. And the incidence of the pneumoconiosis in that migration population is similar with the Rajasthani person uh, of pneumoconiosis. It means it is the role of the environment. Okay. But if the person who is belong to Punjab or belong to some other state and coming to us and after that developed any disease which is genetically related, so it means the disease lies in the genetics. So this is how we differentiate between the environmental factor and the genetic factor of disease. Now we will describe the disease according to age. So there is a bimodality. What is bimodality? That non-Hodgkin's lymphoma has two peaks. One peak of the disease when age of the person is between 15 to 35. Either we will see cases of non-Hodgkin's lymphoma in the population with age 15 to 35, or we will see the cases after 50 here. It is usually seen. Then person distribution according to disease can be described according to sex, ethnicity, marital status, occupation, socioeconomic status, behavior, stress, and the migration. These are the person distribution. Now measurement of the disease. So what we have did till now, we have described the disease according to time, place, person. Now we will measure the disease, that what is the load of disease in a particular area. Okay, where we are doing our study, the total number of disease we can find out the percentage of the affected. Suppose we are doing a study in 1 lakh population and we find out that 1,000 people are having the disease. It means 1%, 1,000 upon 1 lakh, that is 1% is the our incidence. Okay, this is a magnitude. We can find out the prevalence also by this. So it is called the disease frequency. Now, and for this, we have to do two things. Either we can do cross-sectional study or we can do longitudinal study. In cross-sectional study, what is cross-sectional? The important thing about the cross-sectional study is this, that in cross-sectional study, we will contact the patient or contact the population a single contact, single time. Matlab, we have to try to find out all the data by single contact with the patient. Suppose you went to a house to collect the data of a patient, and patient says that I am sleeping out now, and you come tomorrow. And in next day you again go. It doesn't mean that it is a follow-up. Okay, that was not follow-up. The possibility of collection of data in a single examination will be considered in the cross-sectional examination. In longitudinal, what we will do follow-ups. Okay, we will have multiple follow-ups. Okay, today we reach the patient, we find out that patient is having particular disease clinical features. After 5 days, we again went and we find out that patient is okay now or expired now. So that is called follow-up study. So by cross-sectional study, we can find out the prevalence only. Suppose we will visited 1,000 houses in a village and we find out in 1,000 houses, there are 400 patients of the malaria. So it means what is the prevalence? 400 upon 1,000. यानी कि 40% is the prevalence. This is point prevalence. So this is the cross-sectional study. So by cross-sectional study, we can or cross-sectional examination, we can find out the prevalence. But by longitudinal study, we can find out the incidence. So we will discuss about this. So cross-sectional is like a photograph and longitudinal is like a movie. Now comparison of the non-indices. So we will compare the diseased person and the non-diseased person. Okay, so we will make the comparison, and for this we can apply any test of significance, like we can apply chi-square, we can apply t-test and all and all. So we will discuss it in further lectures also. It will be difficult for right now because it is a part of analytical study in detail. Formulate a hypothesis. What we will do, we will formulate or generate a hypothesis. How? After getting all the knowledge, हमें अभी इतना तो समझ में आ जाएगा. We will able to understand that what etiology or what risk factor is responsible or is associated with this disease. So we will make a hypothesis. Okay, and hypothesis is supposition regarding the probable cause emerging after observation of the distribution of disease in time place person. So by checking the time place person, we will make a hypothesis. Now, this is the descriptive study, complete. Now, if we want to test the hypothesis, we have to do analytical study. So by testing the hypothesis by analytical study, our hypothesis is accepted or rejected. It will be done later, not in the descriptive. Just we have just made the hypothesis. हमारा काम हो गया, descriptive study हो गई. अब analytical से हम ये कर पाएंगे कि study को हम ये true है कि गलत है, बात सही है इसकी या बात गलत है. हमने तो कह दिया पहले कि भाई हम सब we concluded that this disease is related to this cause, this risk factor. We have given a hypothesis, but now the responsibility lies on the analytical study whether to accept the hypothesis or reject the hypothesis. Okay, and the hypothesis should be formulated in a way that it can be tested. Suppose we find out that cigarette से smoking से lung cancer होता है, so we have passed the general statement that cigarette smoking can cause lung cancer or causes lung cancer. But now, how we will apply the statistics on this? We cannot apply the statistics on this. So, whatever we always talk about the operational definition. Suppose we have given a hypothesis that smoking of 30 to 40 cigarettes per day cause lung cancer in 10% of smoker after 20 years of exposure. Now, after getting this hypothesis, we will able to find out our target population. We will able to analyze. We will able to analyze कि अब हमको देखना है कि 30 से 40 सिगरेट वाले लोग देखने हैं और जिनमें 20 साल से ज्यादा का एक्सपोजर है, उन लोगों को पकड़ना है और उन लोगों में हमको कैंसर देखना है कि कितने लोगों में हो रहा है. 10% में हो रहा है कि 15% में हो रहा है कि 20% में हो रहा है. हो सकता है उसमें हमको 10% से ज्यादा मिले. हो सकता है इट मे बी पॉसिबल दैट वी गोट सम पेशेंट्स who have developed lung cancer within 10 years of the exposure. It might be possible. So we will test this by the analytical study. Okay. Now, what is the use of descriptive study? It will provide the magnitude of the disease कि कितने area में कितने लोगों में disease हो रही है. It will provide the data for planning. It will provide some knowledge about the etiology and the risk factor. It will provide the knowledge or describe the time place person, and it helps in the research. Now some MCQs ready. Also, it was a little bit long session of descriptive epidemiology. Okay, students. Okay, dear. So it's your turn now. Seasonal trends is due to what is seasonal trend? Seasonal trend, the disease which is coming in seasons. The disease which is coming in the seasons. Environmental factor, is the correct answer. Okay, it might be possible environmental factor because rain is a environmental factor and disease might have seasonal variation due to rain. Vector variation cannot be can't it be vector variation? You think what is vector variation? Vector variation means suppose we are having a mosquito, Aedes mosquito, and there is some variation in the Aedes mosquito that Aedes mosquito become resistant to the medicines, to the insecticide, sorry. So mosquito become resistant to the insecticide. Now the population of the vectors will increase in a particular season, and it may cause the seasonal trend of the disease and change in the herd immunity also. Okay. So environmental factor, vector variation, and the change in the herd immunity, all three things are possible in the seasonal trend. So our answer will be all of the above. Okay. The next one is intra-species competition is the competition among intra-species, not inter, intra. इंटरनेशनल मैचेज अभी तो चल रहा है आईपीएल, इंटरनेशनल तो नहीं चल रहे हैं, but international matches. What is international? International, okay. International matches means the matches between two countries are called international. Here is the intra. Intra means inside the species. Inside the species means the population of that species. Suppose intra-species competition of humans. What will be intra-species competition of the humans? So I am a individual of that species. Suppose I am having competitor with another human that will be considered as an intra-species competition. So individual of that species will having competition. So species, no, species will not be the answer. Species is inter-species. Individual of a population, yes, it can be possible. The individual of the population means the individual of a species, the individual of the community. We are not talking about the community. We are talking about on the larger scale. Community is a small scale. So B will be here answer, the individual of a population. Which of the following is characteristic of a single exposure outbreak? Common vehicle outbreak. Frequent secondary cases नहीं होते single exposure में. Okay. Severity increase with the increasing age. No, there is no age. एज से कोई लेना देना नहीं है यहाँ पे सीवियरिटी का. ओके. एक्सप्लोजिव होंगे, ऑब्वियसली एक्सप्लोजिव होंगे. ऑल आर सेइंग सी, तो हमें मानना ही पड़ेगा अब तो सी आंसर है जब सब सी कह रहे हैं. ओके. एंड कैसे जाकर कंटिन्यू बियॉन्ड द लॉन्गेस्ट इंक्यूबेशन पीरियड, तो बियॉन्ड द लॉन्गेस्ट इंक्यूबेशन पीरियड तो प्रोपागेटिव में आ जाएगा. तो हियर सी इज द आंसर. ओके. एक्सप्लोजिव. गुड. ऑल आर. देन ट्रू अबाउट पॉइंट सोर्स एपिडेमिक इज अकर्स इन मोर देन वन इंक्यूबेशन पीरियड. पॉइंट सोर्स है. पॉइंट सोर्स है मतलब कि वही जो भी अपन बात कर रहे थे, सिंगल एक्सपोजर हुआ. पॉइंट सोर्स का मतलब ऑल केसेज अकर्स इन मोर देन वन इंक्यूबेशन. तो पॉइंट सोर्स है तो मोर देन वन में तो हो नहीं सकता. ओके. प्रोपागेटिव में होता हो तो अकर्स इन वन इंक्यूबेशन पीरियड, ऑब्वियसली हमने पढ़ा है पॉइंट सोर्स में. द एक्सपोजर इज कंटिन्यूअस. पॉइंट सोर्स, इफ द सोर्स इज पॉइंट, देन हाउ कैन इट बी कंटिन्यूअस? It will be in the propagative. And epidemic curve falls very slowly. So what we have studied in the point source epidemic, the epidemic curve rise rapidly and the fall rapidly both. So answer will be B. So all replied B. So this is the correct answer is the B. अब सबने बोला तो सही होगा. Then Bhopal gas tragedy is an example of, again, point source is the answer. Correct answer is the point source. Okay, we are proceeding for next question. The answer is point source. Then the question is long-term fluctuation is seen with. Long-term fluctuations is seen with. The question is long-term fluctuation is seen with. So what was the cyclic trend? Cyclic trend was we have discussed that a disease is coming in every 2 or 3 years. That was like swine flu, like measles cases. Okay. Epidemic is not long term. So we are having only two options, secular and the seasonal. Seasonal is coming in the seasons only, so it cannot be long term. So we have excluded 3 points. So we are having option C only here. So that is secular trend. Now this question might have been asked like this. There has been a gradual increase in number of cases of non-communicable disease as compared to previous years. This trend is called as. So this question might have been asked like this. So the option will be same: cyclic trend, epidemic trend, secular trend, the seasonal trend. So in that case, for non-communicable disease, answer will be secular trend. Okay. So our answer here is C, not the D. Seasonal trend is not related with the non-communicable disease. So answer will be secular trend. Now, true about continuous common epidemic, high secondary rate, duration more than one incubation period, rapid rise and fall of epidemic curve, brief and simultaneous exposure. Okay. True about continuous common. Continuous common. High secondary rate will be seen in the propagated. Okay. Duration more than one incubation period, it is right because it is continuous. अगर point source होता, so there might have been one incubation period. Continuous common में more than one incubation period होगा. Rapid rise and fall, it will be seen in the point source. Brief and simultaneous exposure, it will also seen in the that point source. So our answer will be B here. अब सभी B ही बोल रहे हैं, तो B ही answer होगा. I think this is the cyclic trend is variation in why cyclic trend. Cyclic trend means the cases coming in every 2 year, 3 year, 5 year, 6 year. This is called cyclic trend. So in cyclic trend, it is variation in the herd immunity or changes in the environment, nutrition, or the short term change. So we have discussed that is cyclic trend. Cyclic trend. I told you seasonal trend was due to environment, but the cyclic trend are due to variation in the herd immunity because cyclic trend are affecting the population every 3 year, 4 year. So in 3, 4 year, the immunity generally decrease. There is decrease in the reduction in the immunity, reduction in the herd immunity, or variation in the herd immunity. So herd immunity answer is given by few students A. So this will be our answer. Okay. An epidemic of hepatitis A is an example of epidemic of hepatitis A. Here they have given the word epidemic, and hepatitis A is a waterborne disease. It is a epidemic of infection, and it will not be possible that single exposure. ऐसा तो नहीं होगा कि कहीं एक बार सबने खूब सारा हेपेटाइटिस ए का वायरस एक बार में जाके धरती पर डाल दिया, तो इट इज नॉट पॉसिबल. तो ये तो नहीं होगा. या कॉमन सोर्स सिंगल एक्सपोजर आर यूजुअली लाइक डोपाइल गैस ट्रेजेडी और एक्सीडेंट बॉम्ब ब्लास्ट. Next, common source continuous exposure. The example that we have been given in the common source continuous exposure was the sex worker or the contaminated water supply. Hepatitis A is a disease which might be due to contaminated water supply. But when a person is epidemic, what is the meaning of epidemic? In epidemic, we are having cases from one to one, from one person to another person also. So in hepatitis A, there is a propagation of the cases. Propagation. Suppose you have taken the infection from some place, and you are because it is a disease of orophycal route, so might be affecting the other persons. So it is a infectious origin disease, and always infectious origin disease will be considered in the propagated epidemic. So our answer will be here propagated epidemic. Okay. So when they talk about the epidemic and epidemic of any infective disease, then the cases will be called propagated epidemic. Okay. So this is all about the descriptive epidemiology. And now we have reached to the analytical epidemiology. So we have already discussed about the different types. I have already told you that what are the different types that epidemiological studies are of observational and experimental. In observational, we are having descriptive and analytical. In descriptive, we formulate the hypothesis. In analytical, we are having 4 types CCCE. So in CCC means in cross-sectional case control in the cohort, we are having individual as a study population, and for ecological, we are having population as a study population. And for experimental study, there are 3 types of the study: randomized control trial, clinical trial. Also, we can say random RCT, clinical trial and control trial, both are the same. Then field trial and the community trial. So when there is a word trial, it means it is a experimental study. Okay बच्चों. So I hope ये आज काफी हमने कवर किया है. We have covered a lot about the studies. And in next webinar, we will discuss about the analytical studies. Okay.